So I am a pediatric surgeon by occupation with a focus on pediatric neurology. So I operate on little babies, and so everything in babies which I operate is always high stakes. So even a small little misstep which we might otherwise overlook can have devastating consequences. Now we would see that over the years, and what I've noticed is even simple basic safety protocols like counting the swabs or counting the mobs at the end, if not done properly, eventually it can lead to a lot of problems, not only for the surgeon, but for the patient. And then that can lead to unnecessary loss of man hours, a lot of problems. So essentially, all this needs to be tackled. Now, it is something that I'm very passionate about, something I believe every surgeon, every OT technician, every nursing staff would be very well aware of, and we should be doing something about it. There are always a multitude of reasons why such things happen. So there are human factors involved. There are systemic pressures that are always there, and system limitations. Now let's say I am in the midst of a very long surgery. Say it lasts for 8-10 hours. There might be a case where there might be personnel change. The nursing staff changes. While giving an over, they might forget to mention one swab which is still in place, one mob which has still been left behind. Okay. And there could be always an oversight. There could be profuse bleeding, and a small little mob which has been placed in some pocket to block it might just be lost. All these things can happen. There is always pressure for us to complete a certain surgery within a limited period of time if you are in a private setup, so that you can take other scheduled surgeries. So sometimes, these limitations do crop up, and then such problems which should actually be never events do tend to happen. It's not a very difficult job, but there is a human element to it. It is always fallible. You know, I could be closing the abdomen layer by layer, and we could be having a little conversation. I could be teaching my resident something, and I might completely forget that one of those was that could be my error. The nurse, while counting the remaining bigger mobs, might tend to forget that one little gauze, which she might not even have noticed in the first place. So that is one thing. Okay. If, like I've said, the personnel changes, the surgeon takes a little break, or the nursing staff changes because their shifts are over, that can always lead to such problems. If you have counted, let's say, 5 mobs, and inadvertently you have picked one up extra during the surgery and failed to notice it, in a long duration surgery, even sometimes memory tends to fail
Right.
because you're working under pressure and stress. So that always can happen. We have known about the RFID tagged mobs for a while now. Okay, I also know of people who have tried using AI to detect whether there is something left behind. Okay, so these have been done, but they have been expensive, have not met with much success because, by and large, existing systems have been in place for years now. It is a certain way about which people do go about these things, and they are resistant to change. That's the honest answer. Something that costs a whole lot for such a seemingly simple thing like a swab count, people might not necessarily be very interested in investing. So unless we get something that is cost effective, integrates into existing systems, and it's not very difficult, it would be a difficult thing to actually get something new. That's a very, very pertinent question, actually. See, look, for a patient, a retained swab or a retained mop means an additional surgeon, additional time spent in the hospital, chances of infection. Another surgery has its inherent risks with it. There is obviously increased cost. So all that, not to mention the emotional toil, the emotional turmoil. Okay. For a surgeon, again, now apart from the litigation and all the issues, it is highly defensible for the patient. It is very difficult for me to defend. I should not be leaving a mop in place. And similarly for the nursing staff, she should also have been equally responsible. Not only does it put a blot over probably a otherwise impeccable career, but it does tell you that you do not look at the minimal, the minuscule things which should otherwise be taken note of. So it is a hassle both for the patient as well as the doctor. Yeah, absolutely. I mean, if it is accurate, unobtrusive, and it doesn't actually impair the pace of surgery, look, anything that makes our life easy would always be welcome. If it has all these things in place, why would it be? Both us as surgeons, the nursing staff would definitely welcome something that they, at the end of the day, makes their job easy. Essentially, it has to be something that could integrate easily with existing systems. Like most operation theaters in India, particularly, would use a whiteboard system, okay, where particular sponge counts are already mentioned, and if any additional ones, the floor nurse would be adding to it. If we are able to probably get a visual impact to it, or probably we have a digital whiteboard and we are able to add something to it, or if maybe let's say something that doesn't add to what the nurse has already got to do, but at the end of it, both the surgeon and the nurse are sure that there is nothing left behind and we have a visual tally. Something of that sort would certainly help. And what I essentially believe is some innovation of this sort has to come from the clinician's perspective, because they are the ones ultimately who know what's the flow of surgery, what's the pace, where are the pressure points, where the system has a lack and where we can actually put something in place. iCount, from what I've seen, is very easy to integrate with existing things. We don't have to do anything over and above except get that device and dock it, right? So that is, and I don't think it'll be too expensive also, honestly. And on top of it, you are also providing that AI thing where you can actually like do an overview and see if all the counts are there in place or not. So places where that digital thing is already there, or where, like say for a government setup where you just have to dock those systems, in both places it will work great and integrate, like I said, into the existing systems. So if we have a digital workboard and if we have the app which takes the pick, you can just add it to the already existing whiteboard, and then that will give you a visual proof that now there is nothing left to be done, and both the surgeon can and the rest of the nurse can sleep peacefully. As long as there is a human element involved, these things can never become absolutely zero. Okay. But what we as surgeons and as humans should aim to do is to get the count to as close to zero as possible. Try and get the RSS events as close to zero as possible. Reduce the number of near misses. Ensure that both the surgeon and the nurse or the technician are held equally responsible, and it becomes a dual responsibility shared between both of them. So even if the surgeon is in a hurry or the staff is in a hurry and there is pressure from above to finish off the surgery quickly, this small minuscule detail should not be missed, because it can lead to unwarranted events later.